I drove up and met with some local partners, some heads of associations, and some of the district health officials, and a lot of associations for people living with HIV/AIDS. And we did a service mapping, which means I came up with a 17-page survey, and we gathered into groups of about 20 or 25 at different locations around the district, and we all we walked them through the survey with the help of a translator, and they filled out all the services that the different associations offer, everything from legal assistance to help around the home to school fees to counseling, and we had 10 different categories of services, and we just tried to map out which sectors and which cells the services were available, and how they were available, and any eligibility criteria that people needed to meet in order to receive the services. And what we'll ultimately do is we will hand them out a brochure at the end of this. Each member will get a brochure and with all the services in the area, so that we can help people get a little more connected in and help some of their unmet needs get fulfilled. So that's what we've been doing the last couple days. We had a few bumps, so to speak, had some miscommunication and some, as always the case, some problems in translation before we got here, and so there were some expectations that weren't met around finances. So we had it was quite a complicated trip, but we made it through, and we still, we were able to work through a lot of the problems and still are in good standing with our partners here as we begin to hand off this project. The funding expires next month through CARE, so we're trying to do our best we can to document what we're doing and hand it off to the local associations and some other NGOs, hand off what we've done, and the service mapping is one of them. So I'll be back here in Nyagatare District in about a week and a half to do a round of qualitative data collection, where we'll be talking to doing focus groups and in-depth interviews with the case managers and the community volunteers to figure out, and some clients actually, to figure out what worked and what didn't work in our linkages model, so that we can improve it for other areas, not only in Rwanda but around the world. We're going to document the path that a client takes through the linkages model, and hand that out as we'll send that back to the headquarters in